All right, group. So I'm going to explain to you what to do when a doctor needs to do TPA on a pigtail line. Your patient comes up and has a pigtail. This is not a real pigtail. This is just something that I use that is kind of like a pigtail because I can't, pigtails you have to pay for. So your patient comes up, this is your pretend pigtail, and it's connected to a chest tube and or it's connected to a bulb. Well, the doctor says to you, it's not draining, I want to TPA the pigtail line. So if they're gonna do that, they're gonna end up connecting it to this anyways. So you have to go and get all of your stuff so that they can TPA the line. So the confusing thing about that is that when the syringe comes up from the pharmacy, it's gonna be like a regular IV type syringe. So it's gonna have a port like this, it's an IV one. And sometimes it's like even like as much as like, you know what I mean, 18 cc's or something like that. It might be in a 10, the doctor's gonna be the one flushing this. But when you look down, there's no way for the doctor to flush that in. So what they were kind of doing is disconnecting this, and it's open to air, and they were flushing it and reconnecting it. But that's really not a good way to do it because you're continually opening your system. So what you want to do is you want to get everything together and let the doctor set it up so it's going to be every day. It'll be set up so it's sterile so they can flush every day. So what the doctor's going to need is the doctor's going to need to be sterile, just like as if they were doing things sterile. The doctor's going to be in a gown. The doctor's going to have a head thing. The doctor's gonna have a mask. I'm so pretty. It's all gonna be put on sterile, but you know what I mean. And the doctor's gonna have sterile gloves. Okay. The nurse is gonna set up all the parts. How about if you be the nurse? So now, my friend here is gonna be the nurse. The things that she's going to need are, she's going to need, and it's going to be sterile, she's going to need a pad underneath the chest tube, so throw the pad on. She's going to need a stopcock, and pretend this is sterile because I've already got it all set up. Disconnect those so I can show them that there's a difference. So the stopcock looks like that. It's going to be sterile. It comes in the package. She dumps it on. Then you have a little port and you dump that on, okay? And then you have this piece. Okay, so put that on there. Now this piece right here you get from the CT scanner. And its connection, if you look at it, I'm gonna pretend that it's all sterile. If you look at it, this has an IV end, but this end can go to your reservoir. And this is the only piece that has those two things, IV to chest tube, so that you can make this whole system so you can flush it out. So then the doctor is going to, before she goes over to her thing, she's gonna come over here and she's gonna put this little man on here. She's gonna put this little man on here. It's gonna be marked by the nurse. It's gonna say chest tube on it so that nobody makes any kind of error to think that it's IV. Then the doctor's gonna come over here. She's gonna come over here and you probably will help her make sure that it's all sterile. So it's like that. Okay. And then you might need to have on sterile gloves and a mask because you're the assisting person, okay? Then what she's gonna do is she's gonna have this all set up and the stopcock's gonna be off so that nothing's gonna drain out. And then she's gonna come over here and she's gonna clean with alcohol. If I had an alcohol, she's gonna clean this with alcohol, clean this with alcohol. Where's a clamp? Do I have a clamp? I don't know if I have a clamp. Okay, let's pretend I have a clamp. So she's gonna come over and the nurse, most of the clamps are not sterile, so the nurse will do the clamp, so pretend you're the clamp. She's gonna clamp it, and then the doctor is gonna come over, she's gonna disconnect it after alcoholing it. She's gonna connect it like that. See, it's off, so nothing's rushing out, nothing's rushing in. It's very quick. She's got her clamp on, and then she's gonna grab a 5-in-1. Where's the 5-in-1?
Right underneath the
Oh, here it is. 5-in-1. And like that. Okay, so then you can disconnect your clamp and you've got it all set up. So then what is your doctor gonna do to flush your med? So then you've got your med, and she gets this from pharmacy. It says TPA on it. It looks like a ton of stuff. Then every single day she's gonna come up here, and she doesn't have to be completely sterile for this. She can just use it, clean it off, gloves, clean it with alcohol. She's gonna turn it off so that the fluid doesn't go down, and she's gonna push her med in. She's gonna push it all in to your patient, and then she's going to clamp it off. So that's called dwelling. Your TPA is dwelling inside your patient. And then you wanna let your patient run around as much as possible. Get them up, walk them around, all that kind of stuff, because the more that TPA washes around in there, the better chance when you open it that all the pleural fluid is gonna come pouring out, okay? Now, so really during this time, when it's dwelling in there, you're really not on suction because it's all just sitting in there like that. So sometimes when you open it up, you'll get like a wish of air and stuff like that with your things. So that's gonna be done every single day, and the doctor has to order the TPA. The TPA does not last long. So usually they want to order it and give it. You can't like stick it in the fridge for a long period of time. You kind of have to be on it. And then every single one of these junctures, this needs to be taped really well here, so obviously nothing comes through. This juncture needs to be taped well here, that juncture taped well, all the way down to these taped well. If you put some kind of little pad or something underneath this, something under here so it's not like pressing on your patient, and then tape these with some kind of like foam tape or elastoplast. You want to just secure it really well so things don't fall apart. Make sure you check it like at least every, say, 3 to 4 hours, because when your patient's like running around, things can get loose and you've got all those junctures. So one of the biggest things in what I told you is that piece, this piece. If you take nothing away from this, remember what I'm telling you, you get this piece in the CT scanner. If we don't have them in the peds ICU up in the chest tube area, you could always get that piece, this one piece in the CT scanner, and they're not a chargeable item, and they have stacks of them, hundreds of them. And then that will be able to connect it so you can flush your stuff. And that's the end.